to the channel for We Talk Mental Health. My name is Karen, as always, and today we are going to be continuing to talk about some diagnoses. For today's video, it's going to be all about anxiety and some of the myths associated with it, the different diagnostic disorders underneath the umbrella of anxiety, and some treatment, and just some kind of personal experiences that I'm going to share with you. It's freezing here in Maine. I'm cold in my house, so don't mind the beanie and the fact that I'm, dressed to impress. I'm trying not to die. It's way too cold. I will stop rambling about nonsense and let's get into it. Today's video is all about anxiety. Anxiety, according to NAMI, which is the National Alliance on Mental Illness, is the most common mental health condition in the United States. 40 million adults, reportedly, because there's probably a lot that aren't reported, which is approximately 18% of the US population, battles some sort of anxiety disorder. And we'll talk about those different disorders in a second. Most people, again, this is according to NAMI, develop symptoms for an anxiety disorder before the age of 21, and those symptoms are both emotional and physical. Emotionally, people who may begin to start battling an anxiety disorder often experience a lot of apprehension and a lot of dread, and they can become really tense and jumpy around certain things in certain environments. They can also be really restless or irritable at times, and they anticipate the worst and they watch for signs of danger. Physically, people who may start to develop symptoms of an anxiety disorder have lots of pounding hearts and racing heart rate, sweating or tremors, or twitches, or headaches, fatigue, nausea. Your brain and your body are connected. So when your brain is off, your body is going to experience different things that should be an indicator that something's going on. And if you can rule out a medical condition, then the next step would be to look into seeing if there's something mental health related going on. So, as a clinician, I hear and see and interact with a lot of people who sometimes have a lot of misconceptions about mental illnesses. Anxiety is no different. Society kind of puts these ideas into people's heads that people with anxiety all kind of look the same. People don't always need a reason to be anxious. It doesn't need to be triggered by something. It doesn't need to be, because of a phobia or because of social interactions. Anxiety can be because of a chemical imbalance, but it also can be biological. It can be passed down through genetics. It can be based off an environmental situation or a social experience or a learned behavior. So everybody is different and everybody experiences different aspects of mental illness, and that's one of the biggest things that I think people need to remember, is that there's no one size fits all when it comes to mental illness, and especially anxiety. And the other thing that I wanted to point out was that it's normal for people to get a little bit anxious. It's normal for a person to be nervous. It's normal for a person to, have some sort of fear associated with something in their lives. But when those things and when those symptoms start impacting a person's life and impairing them to a point where it's causing trouble with relationships or with work, or, it's preventing a person from getting out of the house, that's when we would start to consider it to be, a diagnostic condition. So here's the Bible, once again, the DSM-5. I have the big one on the floor, but I'm not going to pick it up. Underneath the umbrella of anxiety disorders in the DSM-5, the handy dandy Bible, it's falling apart, as you can see. I probably should get a new one. There are 11 different diagnoses that a person could possibly be given, depending on the symptoms. They include separation anxiety disorder, selective mutism, specific phobias. Agoraphobia has its own diagnosis, so that's separate. Social anxiety disorder, panic disorder, and generalized anxiety disorder, along with other specified anxiety disorder, unspecified anxiety disorder, anxiety disorders related to substance use, and anxiety disorders related to a medical condition. So those are all diagnosable conditions. So the first one that we're going to talk about is separation anxiety, which is characterized as a developmentally inappropriate and excessive fear or anxiety concerning separation from those whom the individual is attached to. There has to be 3 of the following criteria for at least 4 to 6 weeks in children and 6 or more months in adults. And those criteria include reoccurrent excessive distress when anticipating or experiencing separation, persistent excessive worry about losing major attachment figures or harm coming to them, persistent or excessive worry about events that cause separation, so kind of like anticipating a person leaving and it causing such distress, reluctance to go out or away from home, refusal to sleep away from home, nightmares involving separation, and complaints of physical symptoms such as nausea, vomiting, headaches, stomach aches, etc. when separated from that person. It can happen to anybody. I would say that it's more common in children and adolescents, but I've definitely, worked with adults who experience separation anxiety as well. There are age-appropriate time periods in a child's life where, separation is really hard, but if it gets to a point where it's lasting a prolonged period of time, like I said, 4 to 6 weeks or more, and it's causing significant impairments to their school, to their social interactions, to your family life in general, then it might be worth kind of considering and looking into whether or not that diagnosis would be appropriate. So the second diagnosis is selective mutism, which is a consistent failure to speak in a specific social situation in which there is an expectation to speak, and it interferes a lot with education. It can also interfere with work if it's an adult, and it lasts at least 1 month. The third anxiety diagnosis that we're going to talk about is specific phobias. Agoraphobia has their own diagnosis code in the DSM-5, so we'll talk about that in a second. But specific phobias are fear or anxiety about specific situations, and in children can manifest in tantrums or freezing or clinging. It almost always provokes immediate fear or anxiety in a person, no matter the age. The person actively avoids or endures with intense fear or anxiety, and it's out of proportion to the actual danger that's associated with the specific object or situation, and it lasts at least 6 months. If a person has a fear of heights, or a person has a fear of bridges, or spiders, or animals, or dogs, or whatever, that fear causes significant impairments to a person, then we would consider it to be maybe a specific phobia diagnosis. Versus agoraphobia, which is marked by fear or anxiety for 2 or more of the following 5 situations, which would be using public transportation, being in an open space, being in enclosed spaces, standing in line or being in a crowd, and being outside or away from home. So a person can have agoraphobia if 2 or more of those situations provokes fear or anxiety, lasting at least 6 months, and the person actively avoids those situations in order to avoid the fear, or the anticipation of being in those situations creates an intense fear, then we would consider a diagnosis of agoraphobia. Panic disorder is reoccurrent or unexpected panic attacks, and an attack is an abrupt surge of intense fear or intense discomfort that reaches a peak within minutes. In order for a person to have this diagnosis, 4 or more of the situations must happen, which is palpitations or pounding heart, sweating, trembling or shaking, sensations, shortness of breath, feelings of choking, chest pain or discomfort, nausea, abdominal distress, feeling dizzy, unsteady, lightheaded, or faint, chills or heat sensations, derealization or depersonalization, or having a fear of dying. Yesterday, which was Wednesday, you're seeing this on Friday, we talked about derealization and depersonalization and dissociation on our social media platforms as a way of kind of educating people about those things. So if you're interested in learning a little bit more about that, check those out. Panic disorder is something that runs in my family. I'm not going to get into too much detail quite yet, but it is something that, affects me personally. I don't experience the panic attacks, but it impacts my family in a great way. So, moving on. Generalized anxiety disorder is the other diagnosis under the anxiety umbrella, which is what a person is probably going to be diagnosed with if there isn't like a specific fear associated with the diagnosis, if there isn't a fear of being in social situations, if there's no panic attack aspect to their anxiety. A person is probably going to have a generalized anxiety disorder diagnosis, which is anxiety or worry lasting 6+ months for more days than not for a number of events or activities. There's difficulty controlling the worry, and 3 out of the 6 symptoms must be present. Those 6 symptoms are restlessness and feeling keyed up, easily fatigued, difficulty concentrating or your mind going blank, irritability, muscle tension, and sleep disturbance. So those 6 characteristics, you have to have 3 of them in order to have a diagnosis of generalized anxiety disorder. The good news about anxiety is that it is treatable and it is manageable. The treatment typically consists of psychotherapy in the forms of CBT. I've also kind of seen some research that suggests that there are a lot of other frameworks that help, such as EMDR. But there are a number of frameworks out there that will be very effective in helping a person manage their anxiety. It's just about finding what's going to work best for you. Medication is also an option. Another way that you can help manage your anxiety is learning how to utilize stress and relaxation techniques can be really helpful as well. Like I said earlier, everybody experiences anxiety. The normal amount of stress that a person feels that, is almost kind of healthy. And learning how to manage that stress and that anxiety is super important so that it doesn't become a prolonged and chronic issue and that you don't necessarily develop a diagnosable condition. We don't always have control over that though. Sometimes it's passed down, sometimes it's biologically kind of related. It's not always triggered by an environmental or a social factor. Learning and being self-aware of kind of what's going on, what's potentially triggering your anxiety, how long it's lasting, how it's impacting you. If you start to really struggle to get out of the house, if you start avoiding specific situations because you're afraid of something happening, then it might be worth going and talking to a provider, whether it's your primary care doctor and getting a referral, or just walking into a community mental health clinic and getting an intake and seeing what your options are. There are a lot of different ways that you can treat anxiety, and there are a lot of different things that you can do in order to manage your symptoms. Meditation is really great. Deep breathing has helped me a lot. Yoga, exercise, running has been my main source of therapy for a really long time. You can't see it behind the backdrop, but I have a treadmill that I don't use, so it's my own fault because I live in Maine and right now it's like 2 degrees outside and it's snowing and it's cold. So running outside is my favorite, but right now it's just not an option unless I want my lungs to explode. So I will stop rambling about that now. I'm always willing to, be available to listen, to help kind of try and point you in the right direction. If you have any questions, please reach out. You can find me and We Talk Mental Health on Twitter and Instagram. And if you have any questions, please don't hesitate to drop them in the comments. If you want me to cover a specific diagnosis that I talked about today, or in last week's video about depression underneath the umbrellas of anxiety and depression, let me know and I'll definitely do it. Give this video a like if you thought it was informational. Give this video a like if you thought that I rambled. Give this video a like if you liked my hat. Give this video a thumbs up if you learned something new, and give this video a thumbs up if you are like me and you battle anxiety. I really appreciate you all for watching. Thank you all so much for the support thus far. Please be sure to subscribe. I put out a new video every Friday, and for the next couple of weeks it's all going to be about diagnoses. So if there's one that you want me to cover next, drop it in the comments, reach out to me, let me know. I hope you all have a great week. I love you, you're wonderful, and I will see you next time.